I've been with, doctors over the years and in several states. And I've kind of been on a PCP search, and I usually stay with someone about 2 years, and then, there are just too many problems. All kinds of problems come up. Mostly, they revolve around accessibility. Many years ago, I'm old now, but 40 years ago and 30 years ago, the PCP, the primary care physician, kind of was the one in charge of everything. They got the information from the specialist if there was one, and they coordinated it. And they coordinated if there needed to be many specialists, they coordinated it. Sometimes, like I just had some testing done, and the PCP referred me, but the referral doctor did not get the information back to the PCP. I want a huddle, and I want to be in the huddle. I'd say that's the number one thing, to make me feel like I'm connected. I can depend, if you're my doctor, I can depend on you. I can depend on your availability. It's hard to know when to go in and to have a doctor who's really available to monitor what's going on and know you and know you. That's the big thing, and know you.
I'd like to start out saying that I got into working with children with special health care needs that includes genetics is because of my son. Traditionally, we're not very, at least my generation wasn't, you didn't question authority. But then when it came down to talking with other moms that I met at his various appointments and saying, we share information, and I tell them, well, they didn't tell me that. And they said, well, sometimes they don't. You really have to be the assertive person and say, I want to know what else is available. Some of the docs would call me up and tell me what, the families aren't, I don't think they're following my instructions or giving them the medication the way it's supposed to. And I told them, what brought you to this conclusion? And they say, well, they never acknowledge me or look at me. They always have their head down. And I was like, that's a cultural difference. I said, they're not having direct eye contact with you because you're the authority figure. I said, and in some cultures, if you looked at somebody in the face, they might kill you because you're showing, you're, in a sense, being disrespectful. I said, so you have to kind of, know a little bit more about the different populations you're working with. Well, what it boils down to is funding in order to get these clinics closer to the populations who really don't have access to anything else.
I wish all insurance providers covered, mental health and behavioral health. I think that would definitely improve people's mental health and their mental well-being. I have a family member that is diagnosed with ADHD combined type, and recently, as of maybe the last year or two, was diagnosed with major depression. When I found out my family member was having suicidal ideation, that immediately became a concern for me. So I contacted their primary care provider. My family member has been getting care for almost 10 years from their primary care provider. So obviously a relationship has been established. With that being said, they were able to notice behaviors from way back then, which were normal, like for their age, and then see that transition into, okay, we're exhibiting behaviors that are not normal, like with this age range. So that's something like I really appreciated, because they were able to provide that feedback and express their concerns as well.